every trimester looks a little bit different, and how can we best go into each trimester and support our body along the way?
Ultimately, with respect to training, so much is going to depend on how fit you are going into pregnancy. So keep that in mind as a caveat to everything I'm about to say. If you don't have a workout sort of practice, then what you can do or should do in pregnancy is going to look a lot different than if you're already an athlete who's conceiving. Be fit before you get pregnant, if possible.
Yeah. Hello, everyone, and welcome back to another episode of Wellness for Life. I'm your host, Nikki Wolf. And if you are new to the show, you know we have been deep diving into a season of gut health. But today we're going to take a short pause and talk about such an incredible topic that I think is relatable for so many individuals, so many mamas, new mamas. Today we're going to be talking about prenatal care, and we are going to be doing it with the one and only Nikki Bergen. And she is the founder of TheBelleMethod, the Bump Method, and just has so much to share around supporting women during this prenatal season of life, postnatal season of life, and how we can do that through different fitness modalities, specifically through Pilates. So I'm really excited to dive into this conversation. Thank you so much for being here, Nikki.
Thank you for having me. This will be a fun one.
Absolutely. Well, I'd love to hear, and have you share with our listeners, how did you get to this field and develop, the Bell Method? What inspired you to be creating this?
So I'll give you the short version because this could be its own podcast in and of itself. But basically, I was a dancer, injured my knee, found Pilates. This was all in my early 20s. And I'm now in my 40s. And I found Pilates was such a powerful movement modality to help people really get in touch with their bodies in a deeper way than they were used to. So I saw its benefits for rehabilitation in my own body, but I also saw its benefits for people to really learn how to improve their proprioception. Where are they in space? How can they connect to their breath in a way that they get a deeper activation, not just through their core, but everywhere? So long story short, I left the dance studio where I was teaching and working. I was teaching actually ballroom dancing at the time, and ended up doing my comprehensive Pilates certification. And I've always been a bit of an entrepreneur. So when I graduated my program, instead of going and looking for another job at a studio, I actually bought a reformer, which is a huge piece of equipment. And then I ended up cold calling a bunch of physiotherapy clinics and sport medicine clinics. And I was like, hey, have Pilates, have reformer, we'll travel. Do you have space for me to set this up in your clinic? And it actually didn't take me very long to find a clinic that said, sure, like it's pretty low risk for them. I'm just going to show up, and they don't have to pay me. We'll just sort of, I'll train clients and we'll figure something out. So I started seeing clients right away. And in hindsight, I was way in over my head. I'm in my mid-20s. I'm seeing people who've just had motor vehicle accidents and firefighters with herniated discs and, a 16-year-old who just had scoliosis surgery and has a metal rod in her back, and pregnant women. I saw all these people. So I had to study the night before. It was baptism by fire. I had to study. I had to talk to the people who were smarter than me, who'd been doing this for longer than me, the chiropractors, the physiotherapists, the massage therapists. And I would have to create a plan the night before for the new patient I was going to see the next day. At the end of the day, their insurance started to run out and people would start to say, you know what, I can't do the privates anymore. Can you give us group classes? And so then I would flip the treatment tables over, the clinic would get locked up, and then everyone would come in this carpeted space in the middle of the clinic, and I would be doing group classes. And word spread. And then I had to come up with new locations. And long story short, I had to train other trainers. So I was using my dance background as well as my Pilates background to create movement that people could embody, that was accessible, but also challenging, because let's face it, physio is kind of boring. So I was making physio less boring. And then I had a lot of pregnant women come, and it was this whole thing. It just kind of grew.
Such an entrepreneurial spirit to be able to do that in your 20s. And it's not even to partner with these chiropractic clinics. I feel like that takes things up such a notch. And if you're listening and you haven't done Pilates, it is and I'm not just saying this because I'm here chatting with you, it is my absolute favorite form of exercise. I have a pretty extensive athletic background, played high level softball. I played adult football later in life, and just did a variety of sports. Nothing has transformed my body quite like Pilates has. And I have actually been looking into getting a reformer too, because we have an at-home garage. But something about the classes are just so, I don't know, motivating. It keeps that accountability. I mean, when you're in classes, you see people of all different levels and the accommodations and the way that you can adjust certain moves. But again, nothing has moved the needle as far as like my physical well-being quite like Pilates has. And clearly it's been a success for you. So would you say, starting to work with all these pregnant women, I mean, you're in your 20s, so I'm guessing it was a little bit later when you decided to build out a family, but really what shifted for you to do this bigger focus for pregnant women?
I mean, I remember a moment. So first of all, they all kept showing up to my class. And even though I hadn't had kids in my 20s, I had them in my late 30s. I was like, you guys need your own thing. Like this is not, you can't be doing the same core exercises. I'm seeing coning. And of course, I'm like, what's that? Oh, diastasis recti. Oh, you need to manage pressure differently. So I did certifications, but even the additional certifications I did never really got into the nitty gritty in the way that satisfied my curiosity. So I ended up really like kind of shadowing physiotherapists, pelvic health physiotherapists. One's a professor and a researcher. So just finding my own mentors in this space. And then kind of cobbling it all together and creating my own methodology to really help pregnant women deal with leaking, right? Because it happens, but also postpartum. Like I remember teaching outdoor classes and having them trying to do some semblance of jumping jacks, and they were like, I can't do that. Like half the class was like, I can't do that. I don't have a pad on.
Just thinking of a jumping jack makes me want to pee my pants.
Is that normal? Like I'm 27 at the time. I'm like, is this my future? Like I knew I wanted kids at some point. So it got me curious. Instead of just laughing it off, I was like, I don't want that to be me. I don't think it needs to be everybody. Like, let's dive into this.
Awesome. I love that. And that builds all the skill sets and foundation. So when you decide to have kids, you could start implementing this and now having the education and the experience. But I think it's so cool to be able to be connecting and partnering and mentoring under these like scientific backed professionals. I think that adds so much credibility to the practice, because you see a lot of these practitioners out there, or not practitioners, but, they create these businesses and it's based on their personal experience, but you're not really backing it up with that science and credibility. So I love the blend between the two. But I'd love to kind of walk us through trimester by trimester of different tips, techniques, things that we should be cautious of, because every trimester looks a little bit different. And how can we best go into each trimester and support our body along the way?
Ultimately, with respect to training, so much is going to depend on how fit you are going into pregnancy. So keep that in mind as a caveat to everything I'm about to say. If you don't have a workout sort of practice, then what you can do or should do in pregnancy is going to look a lot different than if you're already an athlete who's conceiving. Okay, so that's something. Pregnancy is not the time to go for a personal record. It's not the time to start a lot of new athletic endeavors that are more challenging than what you're used to. All right, so my biggest advice for anybody is to be fit before you get pregnant. If possible.
Yeah.
Okay.
That was one of the things so I have a 15-month-old, and surprise, I'm actually 9 weeks pregnant right now. So I'm nobody knows that yet, but I'm in my first trimester. And luckily, fitness and well-being has been a big part of my life. But, with my first, I remember I started to get into running, and I read that if you weren't really previously doing this isn't something you should pick up now. So if you're listening, maybe you're thinking about getting pregnant, start venturing out into this. And I mean, I don't know, is it too far of a stretch to say Pilates is generally safe for most people to take? You just have to be cautious of how intense are you doing the exercises?
Yeah, I mean, I have students who have zero background in Pilates and who don't have much of a practice of working out. I also have Olympic CrossFit athletes doing the programs. And that's one of the reasons I love Pilates, because it is challenging, but modifiable for everybody. Yeah. And so it's low impact and it's very focused on pressure management. So how you breathe, how you get your pelvic floor and your diaphragm moving. And for the vast majority of people, it's a new skill that they've never learned. So regardless of whatever athletic thing they've done in the past or haven't done, it's going to be new for them to learn this as a skill. And one of the things I say too is really about like the law of specificity. So for example, I like to think of it as birth being a marathon and you're training for the specific event, which is birth and postpartum. Really, the training that you're doing in pregnancy, it's the long game. You're trying to set yourself up for a smoother postpartum recovery, a smoother and faster postpartum recovery. So rather than me saying, well, you have to do this in the first trimester and this in the second trimester, obviously, the sooner you start, hopefully you're not puking your guts out in the first trimester because that makes it hard to start, right? So, you know, I don't know if you had that experience or not.
It is unreal. I've never felt so good as I do when I'm pregnant. I will say I'm much more tired this time around. That's because I'm also getting up at 5:45 and chasing a toddler. But like relatively speaking, like my health symptoms and concerns practically reversed every time I'm pregnant. So I'm guessing it's just like higher levels of progesterone, your immune system kind of, it's like my body is meant to be pregnant. Very blessed to be able to say that. But I would say pretty much fatigue and like, you know, food aversions and stuff like that. But no puking, no nausea. Yes, I'm very, very, very blessed.
That's amazing. So again, I like to present the information by saying, well, you need to do this in the first trimester. Your first trimester is going to look different if you are vomiting every morning, right? You are going to look different than if you're like, actually, I'm not too bad. Like, I just want some more potatoes. Like, I'm craving carbs, but otherwise I'm fine. You know, like there's so much individual variability. But in general, I say, as a general rule, in the first trimester, it's a good opportunity to start learning how to connect with your transverse abs before they start to stretch out more in the second trimester. You are going to still have a lot of neuromuscular connectivity to those muscles. But when you start to get that constant, those muscles start to get under a constant stretch, you can have more muscle inhibition. So it can get harder for you to feel that muscle connection if you wait to start this work until later in your pregnancy. So it's an opportunity to really start to connect. And this doesn't mean crazy, rigorous training. This is really a breathing technique where you're learning to connect to your pelvic floor. As your baby's bigger, for example, in the third trimester, it gets to be a lot harder to lift your pelvic floor because there's just more stagnation, right? There's pressure there. So if you can start this practice earlier in pregnancy, it's going to make it easier to build that muscle memory now so that it's easier for you to do that in later stages of pregnancy.
Absolutely. Now, how do we, and I don't know if it's as easy to just walk us through it, but how do we practically make this connection? I know you kind of discussed breathing exercises. Is it as not as simple as that, but is that kind of where we begin?
Absolutely. So the breath for a lot of us, so there's really, I tell my students, there's 3 places you can really send your inhale. And when we're at our desks a lot, when we're hunched over, when we're stressed out, we tend to use accessory muscles like around our first and second rib and let our shoulders hike. I know we're listening. You can't see me right now, but I'm sort of hiking my shoulders as I inhale. And this is maladaptive. It's not what we want. So we have to unlearn that and really learn instead to get our diaphragm moving. So we talk about getting the ribs moving. We talk about something called a lateral costal breath. And there are a variety of rib cage mobilization exercises that we can do right away and throughout all of pregnancy to kind of keep things moving. And we can reduce rib pain that way. We can increase the capacity of our lungs so we don't feel that shortness of breath as much. As baby grows, it presses up on your diaphragm, and that can make you feel like you can't get a good breath in. So there's so much that we can do proactively around breathing. And it's not just, it sounds like, oh yeah, breathing, but it actually impacts your pelvic floor. It impacts your pressure management, your core. It can help reduce diastasis recti, leaking, prolapse, all of those things.
Okay. And is this something that you would recommend practicing sitting up? Is this something like on hands and knees, kind of like cat dog in yoga? I mean, what would be, or even on your back? I mean, what is the optimal position?
All of them.
Cool.
Practice all of them. So side lying is a great one. A lot of the times I find that my students have a hard time releasing, right? And especially as women, we're often conditioned to sort of pull it in, suck it in, like, kind of keep everything tight all the time. And it can be challenging to really learn how to let go and to expand allow your belly to expand, allow your ribs to expand, and not have to feel like you're bracing your core all the time. And I find side lying can be really helpful because it's kind of gravity neutral. Hands and knees. Standing can work. I find sometimes people are more prone to sort of gripping in standing. So if you're struggling, I'd recommend hands and knees or side lying.
Okay. And if you were to, throw out a 20-second kind of description of, what we should be doing, what that should look like, what would that be? Like if I'm sitting here right now and you were to guide me through a set of breathing, how would I go about that?
So we're combining a co-contraction of both your pelvic floor and your transverse abs. And your transverse abs is the deepest layer of abdominal muscle that you have. It sort of lives under your six-pack muscle, under your obliques. And the role of your transverse abs is gentle compression of the contents of your abdomen, specifically your lower abdomen. So this is something that you'll see, I post so much of this on social media, but it's this concept of hug the baby. You don't really notice it when you're like 9 weeks pregnant, but if you're 25 weeks pregnant, you see a bump. And then when you engage the core, the bump, essentially you go from like 5 months pregnant to 3 months pregnant when you activate those muscles. So you're going to see a gentle shrink wrapping around the torso, and it's going to look like you're truly hugging the baby, like the baby just got a little bit smaller. So we're looking for two things. We're looking for that to happen in the abdomen, but we're also looking for a gentle lifting and also releasing of the pelvic floor, because we want to make sure that our pelvic floor is both strong and supple. So we can't just be doing Kegels all pregnancy, because then we're going to get too much tension, and then it sort of like makes it harder for the baby to come out. We need to have the pelvic floor that's strong enough so you don't pee your pants, but it's also supple enough to kind of get the hell out of the way so the baby can come out.
Absolutely. I love the kind of language of lifting and releasing. I remember I was doing a postpartum class, and the instructor, the expert, kind of had us imagine like a crane, or like one of those little games where you pick up the toy and you imagine kind of going down, circling around it, grabbing it and releasing it. And I've never, like, it changed the way you do Kegels or even just any sort of pelvic floor practices. I think that does make a difference. So, okay, great. I feel, pretty good with that. I like the analogy of hugging the baby. I mean, whether you're pregnant or not, I think you could all kind of understand what that might look like. Anything else that we should be aware of? I know first trimester, you're not really concerned with any lying down exercises. I can't recall what that date is, that we got to be cautious of that. But anything else as far as exercises that we should be aware of?
In specifically the first trimester?
Yes.
I'd say that, you tend to have more, your heart rate can get up really fast in the first trimester because of the vasodilation. So essentially when you're walking up a flight of stairs, I don't know if this happened to you right now, where you're like, why is my heart pounding so hard? I just walked up like a flight of stairs. Like, what's going on? It's not that you're all of a sudden out of shape. What's happening is your blood vessels have become dilated because of the relaxin in your body that's surging now as your body's building the placenta. So there's a huge hormonal event happening, yet your blood volume hasn't caught up yet to the vasodilation. So it's kind of like you've got big garden hose with just a little bit of blood going through it. So you're going to feel like your heart has to work harder to pump that blood through these bigger blood vessels. So your heart is much more likely in the early stages of pregnancy to feel like it's pounding really fast with just a minimal amount of effort. That does tend to stabilize in the second trimester. Mm-hmm. So I just like to tell women that. So they're like, oh my God, why is my heart pounding? And I haven't really even done that much. There's a reason for that. So just flag.
That makes sense. And I usually, when I do education courses, I explain, nitric oxide, and I use that hose analogy. So I love that we kind of pulled that into and explained it that way. So great. That makes sense. All right, let's transition next trimester. And I know some things are trimester specific, but if there's any sort of, resources or tidbits, pregnancy in general, but if there are more specific things through each trimester, would love to hear those.
So in general, the second trimester, people have heard it called the honeymoon stage, in the sense that you're not nauseous anymore. Hopefully the placenta has been built, so your hormones are slightly more stable as compared to in the first trimester. And you are like, you've got a cute little bump, but you're not feeling like super heavy compared to the third trimester.
It's not bloat, or like when you're out there, when you're like 9 weeks, and now like with reoccurring babies, you tend to grow a little bit quicker, where it's like, you got to put your hand on your belly because you're like, I promise it's not bloated or fat.
Not a food baby.
Yeah, exactly. Or it could be all of the above, but yes.
So yeah, second trimester is really, I mean, you can certainly challenge yourself. Don't be afraid to challenge yourself. Um, you know, work on keeping your glutes strong. I think in general, we need to make sure that we do not underestimate the importance of strong glutes to support your pelvic floor. So we know that you're going to have more issues with prolapse and leaking if your glutes are weak. And so you'll have more back pain. In fact, one of the biggest predisposing factors of back pain is a weak glute medius, which is your upper side butt. So we need to be doing all of the glute work, both like large glute muscles like glute max, squats, but also the sort of finishers, the side glutes, the clams, the side leg lifts, all of that, because it's going to provide so much support for your pelvis, stability, pelvic floor, low back, all of it. So make sure you're starting that. Like, don't wait until you have pain to start that. Be proactive with that. So that's
I love that piece. I think, I mean, I can only connect it back to my experiences, but I would feel like I'm like pretty well-rounded. My glutes completely disappeared. I had zero butt at the end of pregnancy. And I was doing Pilates, up until the whole time, but I don't know if it was like glute focused. And so I love hearing that like this is the time of pregnancy that we really need to be paying attention, because I did have a lot of pelvic floor, like urination, struggled for a very long time. I mean, I'm telling you, I would look at somebody doing jumping jacks and practically pee my pants. And so that makes sense. The connection between the two, that the glutes or your health and the strength of the glutes correlate very strongly with the health of your pelvic floor. So love that. And so it sounds like we need to be doing these deadlifts, squats, but then also some of these smaller accessory exercises.
You got it. Absolutely.
Okay, great. Anything else to consider? I'm again, I don't know if the week that we can't be doing back exercises, I think it's in the second trimester. And is that controversial?
Not controversial. I think it's overhyped, to be honest. Ultimately, it's the risk of there being compression as the uterus gets heavier and the baby gets bigger when you're on your back. The idea is that you could potentially have compression through your vena cava. So essentially get dizzy because now all of a sudden you can't get that venous blood return to your heart because the baby's pressing down on that. But ultimately, I think that it can create a little bit of unnecessary fear in women, because I often have them like lying, they're sleeping and they're like, oh, I woke up when I was sleeping, I woke up on my back. Did I hurt the baby? And I'm like, no, you know what? Your body is, give it some credit. Like if you were feeling dizzy, you would roll over in your sleep and it would be fine. So, I think that, like, for example, like I still teach bridges until your due date on your back. So you can still do bridges, and we're not there for long. We're there for maybe 3-4 minutes. I'm not suggesting to do a whole workout on your back. I wouldn't recommend that. It would probably feel like too much pressure up on your diaphragm, but it's okay to periodically be on your back. And the benefits for most women of strengthening your glutes in a bridge, for example, far outweigh any risks. And if you feel uncomfortable, if you feel dizzy, you're just going to roll onto your side and the feeling should subside quite quickly.
Totally. I remember my first time, I was pretty paranoid, and you hear different things, and depending on how conservative or not your doctor is, but there was a gal in the class, I think was having her third baby, and she was on her back for the entire time. And so it's like each time you start learning, and you nailed it in the sense of like, what is outweighing? Are the cons of it outweighing? I mean, deli meat, kombucha, all these different things, the things that we're told we should avoid versus what we should do. I don't know. I think it takes some discernment to figure out, I think our bodies are incredible things that God has created. And if the functions that it can do, but we wouldn't think that like if you fell asleep and you're on your back, that everything's ruined. I just don't think those align. So yeah, I kind of lean more in that direction. I mean, I'm sure as it gets further along, I'll be a little bit more cautious, but I think we tend to get a little bit more paranoid on those.
Mm-hmm. And your body will tell you if it's uncomfortable, you'll be like, I don't like this anymore, and don't do it anymore.
Yeah.
But until then, have at
it. Or if you start getting dizzy, then that is your sign to like, okay, let me sit up and adjust. Awesome. Okay. What about third trimester? Any specific exercises, body parts that we should be focusing on?
So in general, at this stage, you want to work on continuing to move and probably focus more a little bit on stretching, mobilizing, and releasing for your pelvic floor. So You're going to be, generally, you have more aches and pains in the third trimester. And again, this is a generalization. Things are heavier. So hopefully by the time you get to your third trimester, you have been doing some of this hug the baby, this work. You can kind of rely on the muscle connections that you made earlier in your pregnancy. But even if you're like, crap, I'm late to the game, I'm 28 weeks or whatever, I'm starting now, it's not ever too late to begin. I want to emphasize that. But really at this stage, all movement is really going to help you to connect to your body. And I would say we want to try to prevent a lot of postural changes. So continuing with the glute strengthening a bit through your posterior chain. So fancy word for back muscles, right? The whole back side of your body. So you don't end up in this sort of rounded, hunched position. Lots of stretching and a lot of that breath work. So we have something called the Blossom J breath. We do that during birth, but practicing that now. And you can actually practice a lot of this work when you're having a bowel movement. So you can practice by having your feet up on, I recommend everyone use like some type of toilet stool or squatty potty, and learning to really inhale and use your inhale as the mechanism to open or blossom your pelvic floor. So learning to use your inhale and get your diaphragm dropping, because when your diaphragm moves, your pelvic floor moves. So that's why the breathing is so important, because when we can learn to breathe into our diaphragm, our pelvic floor will respond. So we need to get to a point where we understand, how do we use our inhale to release and open the door? And we're going to use that skill when we're pushing and practice that sort of blossoming, letting go.
Absolutely. Great. That makes sense. And I think this breath work is not only going to benefit and aid us through all stages of, prenatal care, but I'm assuming postnatal and even out, beyond that season of life. Breath work can transform our health and well-being, our mental capabilities so much. So I think learning the foundation, building that into your routine, and just relearning how to breathe. Because I think so many of us, I used to do very heavy lifting, and how many of us hold our breath, and, what is that doing internally to us when we're holding our breath versus, having this constant flow?
Yeah, absolutely. And if lifting weights is great. Keep doing it in pregnancy if you have a practice. Don't start lifting weights in pregnancy for the first time, right? But if you're using like a weight belt, for example, and you're doing the breath holding when you're going for your PR and you're lifting super heavy, like you're not using a weight belt anymore when you're pregnant. Yeah. And you're exhaling on that effort. You're not breath holding, because that's going to create too much intra-abdominal pressure. That's going to lead to more diastasis, more prolapse, too much pressure out on that vulnerable tissue.
Absolutely. And, I have to look back at my experience of like continuously doing Pilates through pretty much the entire pregnancy, weightlifting, exercise, movement. And again, very blessed, but my birth experience was one of the most beautiful things ever. And I have to credit a lot of it to everything that I was doing leading up to it and setting my body up for success to be able to deliver the baby.
There's so many factors, but yes, we know that there's so many benefits of exercise for the baby as well as mom. And typically your labor will be faster if you have been active in your pregnancy. Obviously, there are exceptions to the rule, but typically labors tend to be shorter if you have been more active.
Yeah, especially if you're doing squats and deadlifts, it's probably you're ready for that straddle and ready to push baby out. Well, this was incredible, walking through these different steps. Was there anything that maybe I didn't ask, or different components that you think are important for women who are currently pregnant that they should be focusing on? What if they don't have access to a reformer? Are these things that we can do on the floor? Like you mentioned that you were running these group. Yeah, what should we be aware of?
So we haven't talked about the importance of finding your voice and self-advocating. So that's a huge component in my push prep course. I've got a Pilates and push prep course. It's all mat work. We use light weights, a small ball, like a booty band, small props that are easy to get on Amazon and store in like a basket in your living room. So you don't need a reformer, friends. But really, I think it's important that if you really want to have an empowered birth experience, and I think that's what most of us want, whatever that looks like for you, epidural, home birth, VBAC, even if you're wanting a planned C-section, ultimately it should be your choice. And you want to feel empowered to make informed decisions. In order for you to make those informed decisions, you need to have information. You need to be educated so you can decline things you don't want. You can ask good, intelligent questions to your care providers. determine if you're all on the same page, because you want to be on the same page as your care provider. And so really the formula, I think, is a combination of intelligent or intentional exercise combined with education that's evidence-based, so that not only are you physically trained, but you're also mentally trained. So I think that is really the secret sauce to make sure you understand, you're educated about birth. You're not kind of going in there and just blindly going, well, I've done my exercises, I hope this works out. Like, you might want to have more information to really determine, do I need that induction at 39 weeks? What did the ARRIVE trial actually tell us about the, importance of what did those study results really apply to? Does it apply to me in my situation? What is an episiotomy? Should I have one or not? Like, do I want to have an induction? If I need one, do I want a Foley bulb? Do I want Pitocin? What's my Bishop score? Like, what about breathing? Should I do like what they tell me to do and hold my breath and count to 10 and tuck my chin and have my legs in lithotomy? Or maybe I have more options, and you're going to have to find your voice in those moments and have some sense of what you want and what's evidence-based. So sometimes you might have to push back a little bit.
Absolutely. And I think that is so important in working with, I made sure that my husband and my mom were in the room at the same time. And I made sure that they were fully aware of my wants, my desires, because we're obviously in a state of like chaos, physical, emotional. And so if is that pushback, that I am very competent and confident that they will be able to stand ground. And I think a lot of people don't realize that they can decline so much stuff. I mean, I went as far as like, I declined the, not, work with your doctor, but the glucose test. I never drank that. I did A1C, I tracked my levels, and I showed my doctor. And so there are so many things that you can do. You don't have to accept all the different things, shots, whatever that they are recommending. And so I would encourage looking in and finding what your optimal course is and plan is, and getting your team fully on board and confident so that they can handle it in case things go crazy and you're not fully present, which probably is most cases.
There's so much to say on this. And on a note about the glucose test, like in many countries in Europe, it's not standard. They only give you the test if you have risk factors. So also understanding the evidence around it, and is it relevant to me? And it's very controversial, right? So ultimately you need to do what feels right for you, but take a second and read the evidence and read the research and figure out how you feel about it, right? Before you sort of blindly just go along with stuff that's how you need to do.
Absolutely. Recommend doing that earlier than later when your brain is still kind of functioning and you're not stressed kind of with the deadline. Nikki, where can people find more about you, your programs, and how they can start implementing these practices during their pregnancy journey?
You can find me at TheBelleMethod. So it's spelled BELLE, TheBelleMethod.com. And it's the same handle on Instagram, TheBelleMethod. And you go to my page, you'll see lots of talking about breathing, hug the baby, self-advocating, maybe some funny tongue-in-cheek memes, exercises for postpartum, whether it's a vaginal birth, C-section recovery, prolapse, like all that stuff. So it's all there. And I welcome you to join, and I'm happy to support you.
Awesome. Well, thank you so much for being here and covering this. And then maybe one day we'll start chatting about postpartum and how we can support our bodies through that season of life.
I look forward to it. Thank you so much for having me, Nikki.
Awesome. Thank you.